Fibrous dysplasia. Fibrous dysplasia is a failure of production of normal lamellar bone. It happens due to GNOS mutation or GS alpha protein mutation with a cyclic AMP formation gene defect. It is usually incidental finding and can be congenital. There are three different types. Monoostetic, this means asymptomatic, common in 5 to 15 years of age. Incidental finding after pathological fracture, most common benign tumor in children. It is a lytic lesion with a ground glass appearance. Polyostotic, this is Shepherd-Cook deformity, causing various deformity of the proximal femur. McCune-Albright syndrome, precocious puberty, cafe-au-lait spot, and fibrodysplasia along with endocrine hyperfunction. Complications: subtrochanteric fractures, internal fixation with bone grafting, and malignant transformation. The monoostotic form resolves spontaneously and should be monitored for impending fracture. The treatment normally is curettage and bone grafting, along with bisphosphonates. Some of the book states that a structural bone graft is utilized instead of cancellous bone graft because the normal bone graft formation is hampered.